Richard Horton, the Chief Editor of Lancet, joining us to moderate this webinar. And we are also honored to have a very distinguished panel of experts joining from all over the world to discuss this important topic. Before handing over to Dr. Horton, some house rules and important information. So if you can please put up that slide. Number one, the webinar is being recorded. So, our request to all participants, if you can please turn off your cameras and mute microphone during the presentations or when speakers are making their interventions. That will help us deal with the technology challenges that we every other day we face. The third element is during question and answer sessions, we would request you to either write in the chat box or raise your hand. And I wish you and myself good luck in terms of getting the attention of Dr. Richard Horton and giving you the opportunity. The last but not least, while speaking, we would request you to be brief and as concise as possible. So with this, I'll hand it over to our moderator, Dr. Richard. And Dr. Richard, the floor is yours.
Thank you very much indeed, Wasiq. I really appreciate your introduction and welcome everybody. It's so gratifying to see that there are at least 63 of you, I think, participating for this very important webinar. COVID-19 has brought the world together in a way that we might never have thought of in the past. But the danger is that it will divide us still further. We've seen really remarkable, extraordinary national responses of solidarity and collective action across countries on all continents of the world. But at the same time, we've also seen some very worrying and disconcerting geopolitical tensions become exacerbated. And it's been particularly difficult to see some of the threats to multilateral cooperation, in particular threats to the World Health Organization and its work in the middle of trying to manage and address this global pandemic. So the work of the SIGHT Lancet Commission has strangely become all the more important at this particular moment, how we link together health to ideas of peace, justice, stronger institutions, and through the lens of gender equality. So this webinar is an opportunity for us to explore some of these issues, and I'm particularly pleased that we can welcome President Tarja Halonen, who is of course from Finland, and most importantly for our discussion today, Chair of the SIGHT Lancet Commission on Peaceful Societies Through Health and Gender Equality. We have indeed got a tight agenda, and I'm going to do my very best to keep us to our timings. And so let me immediately hand over to our distinguished colleague, Dr. Ahmed Salim Al-Mandari, who is the Regional Director of WHO EMRO, for his opening remarks. Dr. Al-Mandari, over to you.
Thank you very much, Richard, and thank you for moderating this important session at this critical timing and moment in our history, as you said. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning, good afternoon, and good evening, colleagues. Excellency Tarja Halonen, Excellency Dr. Ahmed Al-Saidi, colleagues, good afternoon to you all, good morning, and good evening again. I'm really very pleased to join you in this webinar on the COVID-19 pandemic and peace. It is truly a vital subject. COVID-19 is a global challenge, but in the Eastern Mediterranean region, that challenge is exacerbated by the conflict that affects so many of our countries. Without peace, we cannot hope to achieve lasting improvements in health and well-being in our region. However, we are also witnessing an extraordinary expression of solidarity in this pandemic response. In the early days of the pandemic, the UN Secretary General issued a call for ceasefire in all conflicts to focus on humanity's collective fight against COVID-19. The results of this appeal have been mixed. While opposing sides are collaborating in some countries, in others, opportunists seek to exploit the fragile conditions created by COVID-19 and further escalate tension. This raises a major question. Can the pandemic help us promote peace in conflict areas? Or is it going to further embed the work of the humanitarians, development and peace community? The question is fundamental for our Health for Peace initiative in this region, which began in early 2019. Using a three-pronged strategy, we are promoting evidence or linkages between health and peace, building peace skills among healthcare workers in conflict countries, and broadening partnerships. This webinar is one such effort, and I am very pleased that we have been able to partner with the Lancet-SIGHT Commission on peaceful societies through health and gender equality. Colleagues, COVID-19 is likely to stay with us for some time. For an optimist like myself, the solidarity-driven response to it is an opportunity to create dialogue between opposing parties. It reinforces the sense of unity among us all. If together we can channel this optimism into practical actions, we will create an enduring legacy that goes beyond the COVID-19 response. There are encouraging signs in our region. Parties in conflict in Libya, Sudan, the Syrian Arab Republic, and Yemen have already expressed their willingness to accept the call for a ceasefire. Such efforts are inevitably fragile, but the best way to sustain them is to keep making an effort. We in the health community are now center stage because of the pandemic. Our voice is heard and often welcomed, including in conflict zones, because of our neutrality and commitment to improving the lives of people. I therefore believe that we can achieve better progress than ever before in using health as a bridge for peace. We have convened this discussion together with our colleagues at the Lancet and SIGHT Institute because we all share the desire to help create more peaceful societies using all our strengths, mandates, and available opportunities. Your wisdom, advice, and experiences will help us and our colleagues working in conflict-affected areas to identify the opportunities to link pandemic response and peace efforts. Colleagues, I would like to request your help with one situation in particular. We are witnessing a potentially devastating situation in Yemen. The complex combination of politics, conflict, humanitarian access, and COVID-19 epidemiology is creating an unprecedented environment. The people of Yemen need the world's attention more than ever before. Please use your influence to remind the world about Yemen and its people and their needs. Colleagues, history will judge us all by how effectively we responded to the needs of the poor and the helpless, such as those in Yemen and many around the globe. I am very grateful to all the panelists and participants attending this webinar, and I look forward to a very productive discussion. And before I say thank you, I would like just to assure you all colleagues, leaders, wisdom around the globe, that we are fully committed here in EMRO, at the regional office, at the country offices, and WHO at headquarters, with member states to bring peace and to develop health and help those who are in need of our help at all moments. So we are fully committed. We are with you all the time, every moment, to relieve the suffering on the human beings here in EMRO or outside EMRO. Thank you very much for giving me this chance, Richard, and the floor is yours. Back again. Thank you.
Thank you very much indeed. Thank you very much indeed. Dr. Give you a reciprocal thank you to you personally and your colleagues at EMRO for the incredibly important work that you are doing in the region. You are a beacon to the rest of the world for your commitments at this very challenging time. Let me turn immediately to my friend and colleague, Dr. Anders Nordstrom, who, as you know, is Ambassador for Global Health in the Ministry for Foreign Affairs in Sweden, and has been a crucial partner in shaping the ideas and work of this mission. Anders.
Thank you very much, Richard, and very happy to be participating in this this afternoon or morning. Yes, as you say, the Swedish government, the Minister of Foreign Affairs, has been strongly supportive of this commission, both in terms of some potentially technical advice, but also financially and politically. And we are delighted to have President Tarja Halonen to chair the commission, but also to have Sulpi Butta, who we will hear later on today, Peter Freeberg, and Katrin Kjöbot-Tingi as the co-chairs. And Peter then also being the director then for the Swedish Institute for Global Health Transformation, who actually then provide the secretariat for the work. Let me first say just one word about Yemen, as Dr. Ahmed is bringing that up. We are very concerned about the situation in Yemen, also from the Swedish government. My Minister for Foreign Affairs spoke to the Secretary General about this just a couple of days ago. We are monitoring closely, of course, the COVID situation, but more importantly, the peace situation more at large, and also other potential health implications for people. We were hosting the peace negotiations here in Stockholm less than a year ago. So we are fully behind that. We need to pay the world's attention to that very specific situation. A reflection then on the agenda for today and the crisis we are in right now. What makes this crisis, what makes this pandemic, this health threat different from what we have seen in the past? What's different from the SARS? What's different from avian flu? What's different from the Ebola outbreak that we had less than 4 or 5 years ago? It's actually linked to this agenda today, and I would say what's different is anxiety. Anxiety among people, anxiety among the stock markets, and anxiety among politicians. What we have seen today, which was a big surprise, I think, for everyone, and including for myself, was the way that this triggered anxiety among people. We didn't see that before. We had it a bit, but this time. And what that has led to in terms of, as I said, the stock markets, the economies, and then the politicians then being forced, actually, I would say, to take not always decisions based on best public health evidence, but in order to be able to cope with people's anxiety. And I think that anxiety among people has also been very much, of course, influenced that we have a different information communication society today with social media at the center. So I think what we have today is a very fragile situation where anxiety is really the new ingredients here. So what's the treatment and what do we need to think about for the future? I would say that the treatment for anxiety is trust. So whatever we can do and whatever this commission can do also to take forward what you were saying, Richard, I'm seeing your fingers now. I'll try to avoid that. In terms of trust, what does that de facto mean, and how can you actually invest in institutions that people, the stock markets and the politicians actually are trusting, are believing and are using? But also, how can you actually invest in enabling people to trust data, to trust what they hear? What should they hear? What should they rely on? The whole credibility of our information and data set up today is about moving in a direction where people actually can feel comfortable and trust. And of course, the geopolitical situation we have right now, the lack of trust, quote unquote, in between China and the US. So for me, the word is trust, that we need to think more about. And of course, now we have a health situation that have triggered a very dangerous situation where there is a lack of that. So potentially for the future, when we are going to revisit the international health regulations, which are about controlling the virus, we need to think about also how can we not control people's anxiety, but actually to enable people to feel less worried and to be able to trust more.
Thank you very much.
Thank you very much, Anders.
I'm very pleased to welcome President Halonen here, as I mentioned at the beginning, and she is very kindly offered to make a few brief remarks to us. So if I could perhaps, before we go into session one, invite President Halonen to make a few comments.
So good morning, or no, good afternoon already. Good afternoon in Finland. Just a few things. I think that when we have earlier separated war and peace, and then we have spoken very much the new type of the conflicts, then of course we have tried to put these challenges in different boxes. And for instance, in Europe, we have had a different civil crisis management, and then we have had a military crisis management, and that has been also in UN and in many other organizations. Now we see that these kind of silos are not quite up to date, that they are very different ways now, especially I think that this COVID-19 has been a lesson for us to see that which kind of the enemies, which kind of the challenges we have. What we have now noted already so far concerning this new type of the challenge is that the countries are in very different position. It's not going in the classical way that whether you have so-called developed country or developing country, but it's also different. And I dare to say also when already my good neighborhood representative in the way Mr. Anders Nordström from the Global Health from Ministry for Foreign Affairs from Sweden has spoken. So we have thought earlier that, for instance, the Nordic countries are like 5 Nordic sisters. But now also based on the tactics how we have faced these challenges in COVID-19, so we have very different kind of the figures in health. And of course, I could tell that how the Sweden has 10 times more deaths what we have, but it's not yet the time all that. I will say that we have to see the health, we have to see the post-COVID situation, economy, but we have to see also the social partnership and its importance for the people's well-being during the conflict and after that. And so even in one country, the situation with citizens, refugees, asylum seekers, indigenous people, and many other groups, also including the situation of the men and women, are different. So this is really a very good but hard time to learn more about these kind of the challenges. And then I think that my good news in the way in this situation is that we have noticed that in many different places. For instance, today we have this, our good cooperation with Lancet-SIGHT, and could I say that in interesting way, we, especially my Swedish friends, they estimated already before we had a COVID that this kind of the situation can become. Of course, we started from the military conflicts, but all over that there can be also the different kind of challenges. The same situation now we are discussing in every woman, every child committee in United Nations. It's next week. We will speak also this week, and next week we will have also the meeting advisory board in mediation for Secretary General Guterres. And we can continue many other places where we have been discussing. Myself, I have been involved in this kind of the discussions with the Emirates. I have discussed in New York and so on. And I will say only that now it's extremely important, dear experts, welcome visitors. It's very important that we could find each other to notice that which is typical in different countries, in different regions, and different people groups. And we are very ready now to listen that what are our experience. It's perhaps too early to draw the conclusions, but at least in this historical moment, we have to be very, very open, with open eyes and open ears to do that. So I don't speak more. I'm ready to discuss you. I'm happy that we have all come together. And if I can say the next positive thing is that we have avoided a lot of traveling now. And this is an ecological thing, but perhaps we also learn to meet each other more personally by this kind of the discussions. Thank you very much.
Thank you very much indeed, President Halonen, and I really appreciate your remarks. And if I could also appreciate your leadership of our Commission at this important moment. Let me now move straight into session one, which is on the COVID-19 pandemic in conflict-affected countries. We're going to discuss this in several different locations, and our first speaker is Dr. Mamunur Malik, who is the WHO representative in Somalia. So may I hand over please to Dr. Malik.
Thank you, Richard, and thank you, colleagues. I work in Somalia, and if it's not quite a surprise to many of us that this country was once called the Switzerland of Africa, owing to its vast coastline and natural landscape. Since the fall of the central government in 1991, the country is facing recurrent war, insurgency, and armed conflicts. The resultant humanitarian toll has devastated the economy, public institutions, and created a large loss of human capital. Today, close to 69% of the population of this country live below the poverty line. The country's governance structure and the clan-based society whereby power is monopolized often add to this division. Though the country is slowly recovering towards peace and stability, its health system has not yet recovered fully. Despite some slow progress in under 5 mortality rate and maternal mortality ratio, the gains are not substantial and not sustainable. In this trying background, what WHO Country Office in Somalia is doing is to optimize opportunities to contribute peace through health. Funded by the UN Peace Building Fund, we are implementing a project on peace building through improving mental health care for young people affected by conflict in Somalia. Our reasoning is that decades of conflict and violence have led to economic marginalization and social exclusion of the young people in this country, who comprise of 70% of the population. These are the drivers of poverty in the country, contributing to social unrest. As over 50 to 60% of these young people are largely unemployed, they remain the prime targets for extremist groups. We are targeting this youth to break the cycle of exclusion and make them the positive agents of change. While improving access to mental health and psychosocial care for these young people, we are also aiming to better understand the links between mental health and peace building in conflict settings, which remains poorly understood. Now let us turn our focus on COVID-19 and our own analysis how this can unlock opportunities for peace. The outbreak is evolving fast, and we also see a number of tragic events unfolding very fast. The country has reported the highest number of deaths amongst any other East African countries. It is 67 as of today. The weakened and the fragile health system is on the verge of breaking down and straining other essential healthcare. As a fallout, we'll see a lot of health gains being pushed back. The life-saving vaccination coverage may drop by 20%, facility-based delivery will decrease by 4%, and the childhood mortality can increase by 13% if this situation continues. The economic downturn of this pandemic can equally be catastrophic. In the slower run, we can see close to 4 million people will be food secure. there can be a 30% loss to the government revenue. Beyond this number, the human tragedy that is unfolding is such a fragile setting could be devastating. We have already seen people being resorted to violence in the streets in Somalia and Mogadishu, going to lockdown, especially those who survive on daily wages. The situation can lead to destabilization and social unrest in these tense circumstances. Now, my question is, can we turn this page to opportunities so that peace does not become a casualty? My answer is, perhaps we can. COVID-19 has given us the realization that we all are equally vulnerable. The virus is a great equalizer. We now have the opportunities to build back better, build public institutions that can withstand the shock of this nature with an eye on inclusivity and resilience. Using the lens of unity, we can enhance trust between people and the government institutions. Now, more than ever, the concept of universal health coverage based on universality, equality, and quality of healthcare need to be pushed, leaving no one behind. As no country can contain the impact of pandemic alone, we have to use economic cooperation between all the wealthier nations and fragile states to turn the crisis into opportunities for self-reliance. In closing, I would like to say that the trajectory of this epidemic is changing very rapidly. Crisis can unlock opportunities for peace, and it is possible to advance both health and peace if done rightly. We must remember that in this interconnected world, we can be only as strong as our weakest health system. We cannot defeat this virus in the shorter run, but certainly we can win this war against health inequality and exclusion that threatens peace and stability everywhere. Thank you very much. Back to you, Richard.
Thank you very much indeed, Dr. Malik, and thank you for emphasizing the importance of the values that underpin universal health coverage. Universal health coverage isn't simply a technical objective, it is also a moral objective, and the values that underpin it are so essential as we begin to reconstruct our world. Let me move straight away to Libya and to Dr. Elizabeth Hoff, who is the WHO representative in that country in Libya. Dr. Hoff, over to you, please.
Thank you and good afternoon. When the COVID-19 pandemic started, the UN called on all warring factions in Libya to lay down their arms and support countrywide preparations to deal with the disease. Unfortunately, these calls have been ignored. In fact, the fighting has actually intensified. The official UN government, called the Government of National Accord, might have been spurred on by recent military successes, retaking control of some areas that were under the control of the Libyan National Army, which is the opposing side in the Libyan conflict. Also, cases of COVID-19 remain pretty much stagnant, with only 99 confirmed cases, but this is likely due to the very low capacity to track, test, and treat patients. We don't know how many people have the disease. We don't know whether home deaths are increasing, because Libya has a very poor health information system. We do know that some segments of the population, migrants and refugees in detention centers, and people in prisons are particularly vulnerable to the disease, but we have very limited access to these places. Many other factors are hampering the health response. For example, there is very little coordination between the rival health authorities in the east and west of the country, and this has led to leadership, management, and information vacuum. Hospitals and other healthcare facilities are attacked regularly, and many of them have been forced to close or suspend their services. Thus far this year, there have been more than 19 such attacks. To all this, add the 400,000 Libyans who have been displaced from their own areas, the 640,000 migrants who have either been detained or who live in fear of being picked up, and the country's collapsing health system. It's hard to see how health is currently contributing to peace. In fact, the COVID-19 crisis has in some ways exacerbated the national polarization. The rival governments in the East and West have introduced separate measures to combat the pandemic. Both sides of the conflict have attempted to make political capital out of the crisis by discrediting the opposing side and declaring that they have the capacity to respond on their own. Municipalities have reacted differently to the Tripoli government's allocation of funds for COVID-19. Some have categorically rejected funds, others have welcomed the money. In the absence of a coordinated national response, many municipalities have imposed their own regulation and taken own measures, such as establishing local COVID-19 crisis committees. Inter and intra-communal tensions are increasing, in large part due to the lack of clear communication around COVID-19, and xenophobia is on the rise. Depending on how the situation evolves, if rival governments are perceived to have managed the crisis differently, with different levels of success, there could be a shift in public support from one side to the other. This could affect the power dynamics and have profound implications for the political peace process. The question is how COVID may be changing conflict dynamics and opportunities and/or challenges for the health community to contribute to peace. The peace talks have almost stalled over the past few months. Ordinary Libyans are pessimistic about the chances of a breakthrough and fearful for what the future holds. They are also disappointed that the political process has not resulted in any tangible improvements in their daily lives. The COVID-19 crisis has exacerbated challenges implementing the conclusions of the Berlin conference and could potentially deepen divisions in the country. The UN is faced with a dual problem. Firstly, the delayed political process decreases the likelihood of a comprehensive peace settlement in the near future. Secondly, options for cross-party cooperation and dialogue are increasingly limited, and both societal and political leaders are even more polarized. In summary, there are three drivers of the peace process. On the political side, there has been little progress on international efforts to mediate peace and increased polarization inside the country. Militarily, there has been a significant intensification in the fighting, with international involvement leading to shifts in political control in some areas. Lastly, economically, the fight for control of national resources continues with devastating impacts on the lives of ordinary Libyans. Water and electricity supplies in the West have been cut off by warring factions. The oil blockade is costing the country billions of dollars in lost revenues. The authority may use the emergency measures introduced to limit the spread of COVID-19, such as curfews and movement restrictions, to gain further control over the country's citizens, hide or justify human rights abuses of rivals or vulnerable groups, or target political opponents. Preferential treatment of some groups, for example, in terms of access to healthcare, may also deepen tension if some groups are perceived as being favored over others. That said, WHO does see opportunities to use health to promote peace. The response to COVID-19 actually opens the door to the possibility of cooperation across rival authorities and communities, both nationally and locally. The response must be transparent, fair, and impartial in all parts of the country. I learned from my time representing WHO in Syria at the height of the conflict that working together and planning across the political divide were essential, and being perceived as impartial was absolutely critical. In Syria, we were consistent in our messages that anyone needing humanitarian health assistance had to be treated equally, regardless of their political or religious affiliations or where they happen to live. I am following the same approach in Libya. We are scrupulously adhering to the four humanitarian principles of humanity, neutrality, impartiality, and independence. in a country where some political factions view the UN with deep suspicion, this will be more important than ever. In Syria, for example, we expanded the disease surveillance system to encompass well over 1,000 reporting sites in all parts of the country. We did this by expanding the principle that disease knew no borders and did not distinguish between people of different political persuasions. Thanks to this unified surveillance system, we were able to avoid major disease outbreaks even in the darkest days of the conflict. Whenever there were even small outbreaks, we responded immediately to halt their spread. People, by which I mean not only politicians, but also ordinary Syrians, recognized that we were a neutral humanitarian agency whose goal was saving lives. Shifting attention away from the political and military conflict and focusing on the need to come together to tackle COVID-19 may, if managed effectively, provide an opportunity to build trust between the rival national institutions and demonstrate the need to resolve political differences constructively. Capitalizing on cooperation among health to achieve national peace dividends will depend on the willingness of national political leaders to engage constructively with their rivals.
Dr. Hoff, can we draw to a close?
Yes, I'm closing in 1 second. That military solutions are not viable. They may appear unlikely, but opportunities should be seized if it appears. Then I just want to conclude by a note of caution. If COVID-19 is to be used as a platform for health diplomacy, we will need to undertake a comprehensive conflict sensitivity analysis, especially around the possible negative aspects of proposed health interventions. While we cannot foresee every negative consequence of our action, it does warrant a reflection on the do no harm aspects of any interventions that we propose. Is there a risk that might actually exacerbate the conflict? If so, how will this risk to be mitigated? Moreover, with COVID-19 might provide the impetus for health diplomacy, we must go beyond the disease and include other pressing public health concerns, including humanitarian relief, access to medicine, disease surveillance and control, and maintaining essential health facilities. Thank you very much.
Thank you very much, Dr. Hoff. And can I remind everybody that if you would like to enter your questions into the chat panel, then when we come to the Q&A, we can pose those questions. Let me turn immediately. I can see him on my screen. It's great to see you, Zulfi. And it's a pleasure to invite you to give a response. Let me formally introduce you, Professor Zulfikar Bhutta, known to all of you, the founding director of the Center of Excellence in Women and Children's Health at the Aga Khan University, and he is a co-chair, very importantly, of the Lancet-SIGHT Commission. So Zulfi, over to you. Oh, you're on mute. Can't hear you.
Yeah, there we are. I thought people were unmuting directly. So Richard, delighted to be able to participate in this very important webinar. And I'm conscious of time, so therefore I'll keep my remarks succinct. So it's no surprise that we have these huge crises and challenges in Somalia and Libya. In fact, fortuitously, our review paper on the country case study of Somalia in relation to humanitarian response and conflict was just published today. And I've been reflecting on how many of the messages and points made by Mr. Malik resonate with what our 2 years analysis shows. So principally, it is therefore not surprising that many of the vulnerabilities that conflict as well as outbreaks represent are exacerbated in circumstances which bring together these two overlapping challenges in many of these populations. The basic question is, what is the evidence out there that health can be a bridge for peace, particularly in circumstances where fragility is such a dominant issue. And I think in order to principally use some of that evidence in determining our response to COVID-19 in those circumstances, we need to flavor some of the aspiration with the ground reality. And the ground reality is that while there is theoretically and in terms of the conceptual frameworks, a possibility that health can be a true bridge to peace, the empiric evidence out there is mixed. And most often where there has been an impact of health on peace, which is more than just short term, it is always interspersed with some efforts on conflict resolution and some rehab or restitution work that is based on community engagement and buy-in. Over the long term, as everybody more or less knows, factors such as leadership, locally, trade and economic interests, economic development, and alleviating historical grievances, which are sometimes the dominant form of the genesis of these conflicts, are absolutely important, and they typically supersede some of the short-term measures that may relate to issues that we face today. There are examples in the global literature which tell us how those kind of efforts have led to peace in local circumstances. And I don't need to go through the history of how rinderpest eradication in the 90s and how, for example, the guinea worm eradication in the 80s has played a significant role in terms of linking health as a bridge to peace. And in some of the same geographies that we are talking about today in Africa and in other parts of the world. The COVID-19 pandemic forces us to face some unique challenges that are notable in the current circumstance. And they relate to the connectivity of the world and the fact that we are now dealing with a role of social media and communication like no other conflict or no other humanitarian crisis has faced before. So audience would know that there are just as many conspiracy theorists out there, anti-vaxxers out there who have got the space at the same time as the work that many of you and us want to do. So the role of social media in this has both been the yin and the yang, the positives and negatives, as we've also seen in many high-income countries. And therefore, opinions in terms of what is an optimal strategy moving forward is completely divided. In my own country of origin, the government's been virtually forced to withdraw any restrictions in terms of social distancing on the basis of not only pressure from the poorest of the poor, but also political pressure from people who just did not believe that that was an optimal strategy. We have many colleagues from Sweden who have taken a different path from others in terms of how we need to do. But I also want to point out the fact that we also need to be cognizant that higher purposes that you and I aspire for are sometimes, as I say, tripped by the sheer brutality of conflict that we face in various geographies. I'm reflecting on how in Afghanistan, in the middle of the holiest month in the Muslim world, we saw the absolute travesty of an attack on a maternity hospital with newborn infants and mothers in Dasht-e-Barchi. And it boggles one's mind, even when you look at simple, basic norms in many of those circumstances, how humanity can stoop so low as to do something like this. And therefore, we have to be cognizant that reaching out to just the good side of people at times in this kind of a complicated circumstance may not necessarily work. What do we do in terms of moving forward? And I'm bringing this to a close. So I think if we are going to recognize that peace measures, multifaceted as that may be, will play a big role in addressing some of the issues around conflict and the overlay of pandemic risks on conflict, then we have to contextualize that to local circumstances and recognize that the very genesis of conflict may be related to things that we may need to address in our response. And I'm particularly reflecting on the fact that in many of these conflicts, the root causes are in the social determinants of conflict out there. The vast inequalities, inequities that many of these populations have faced, the enormous governance challenge in many of these circumstances, and frankly, the geopolitical external factors that have influenced many of these conflicts that we see today, which have nothing to do with what people want, but have everything to do with the world has wanted. So therefore, addressing some of those issues become very important. And I want to close, Richard, with a citation from a very close friend who wrote these prescient words about 25 years ago. And he was reflecting at that time in the conflict circumstances of Afghanistan, Pakistan. And Kaisar Bengali said this, and I believe it's absolutely true. He said that unequal societies are unjust societies. And unjust societies lose their moral and political legitimacy. While poverty causes hardship and deprivation for those caught in the poverty web, inequality causes a sense of grievance and injustice, promotes despondency and anger, and generates social and political instability and even violence. So I'm reflecting on your own comments, Richard, earlier on, that maybe universal health coverage and the direction of travel offers us a much more unifying language at this stage that brings in social justice, equity, and the basic principles of how we need to care for the needs of the poorest of the poor. That might be a way forward in this absolutely tragic nexus of pandemic and humanitarian emergency. Thank you.
Zulfi, thank you so much for those words. And that quote, unequal societies are unjust societies, is one that we should all have tattooed onto our hearts. It's a rousing call for our commitment to the right to health, equity, and social justice, the three underpinning foundations of much of our work in global health. Zulfi, thank you very much indeed for those words. Let me turn now to another great friend and somebody who I admire really deeply for her work. And that's Professor Rita Jakkuman, who, as you know, is Professor of Public Health at the Institute of Community and Public Health at Birzeit University in the occupied Palestinian territory. Rita is a tremendous leader and somebody who really lives the idea of translating her work into action, and not just action, but political action. Rita, let me hand over to you. Looking forward very much to what you have to say.
Thank you so much. Hello, everyone. Richard, it's so good to see you and hear you. We miss you.
Thank you.
Our experience with COVID and conflict in the occupied Palestinian territory is dual in nature. While factional fighting intensified elsewhere, suddenly we have cooperation between Fatah, the Palestinian faction on the West Bank, and Hamas, the Palestinian faction in the Gaza Strip. COVID-19 has managed to do this in a few hours after years of many working towards reconciliation and not succeeding. Yet Israeli military occupation and Israeli settler violence have increased during the pandemic, to include the seemingly imminent annexation of about 60% of West Bank Palestinian land by Israel, and the continued choking siege on the Gaza Strip during the pandemic, despite knowledge of a stunted and severely starved health services unable to cope with the pandemic there. That is, we have had reduced and intensified conflict at the same time, reduced internally and intensified with the Israeli occupied. The Palestinian Authority and Hamas, for a change, have done excellent work in trying to contain the disease with appropriate action, lockdown, erection of quarantine zone, informing the population regularly. This has been supported, of course, by WHO occupied Palestinian territory, which has been great really in providing the support and excellent cooperation. However, people are beginning to protest lockdown. They need food on the table. Between an already captive economy due to Israeli occupation, the lack of control by the Palestinian Authority over land, water, borders, and resources, and the lockdown, the Palestinian Authority is unable to help, and people's financial situation has become dangerously difficult. As a result, the Palestinian Authority is easing lockdown. Let us hope cases will not spike again, as has happened early April, when Palestinian workers inside Israel returned home without being tested by Israel. It should be noted that Israel is responsible for the health of unoccupied people according to the Geneva Convention. At the same time, Area C, which is about 60% of the West Bank, is controlled completely by Israel. This is where much of the crossing of Palestinian workers to and back from Israel takes place. Yet, these workers do not get tested by Israel when they go home. Likewise, the Palestinian Authority has no control whatsoever on East Jerusalem, as it has been quote-unquote annexed by Israel. Another form of war and conflict is called neglect. As of yesterday, 374 cases were reported for the West Bank, 61 cases for the Gaza Strip, and 179 in East Jerusalem. To also note, we have had Palestinian refugees in the OPT from 1948 and 1967 wars, and the United Nations Relief and Works Agency for Palestine Refugees has been taking care of Palestinian refugees since 1950. Some of these refugees have survived over 70 years in camps, waiting for the right of return to their homeland. And thanks to UNRWA, every effort is being made to contain COVID-19 in these camps. However, as is the case elsewhere, COVID-19 is affecting population groups differently. The poor, refugees, and other excluded groups are taking a disproportionate burden of infection. Women are overburdened. My students just completed a little study which demonstrated what I call triple captivity. The women have to do the homeschooling. They have to care for the children. They have to do the sanitation at home. They have to do the cooking because the family is at home, so they have to eat more. And so they also want to soothe the children when they are anxious. So they are under triple captivity of occupation, COVID, and patriarchy. And now that structural inequalities have articulated with the pandemic in glaring ways, let us hope that this would be a wake-up call for all countries, a call which should lead to serious efforts at reducing inequality everywhere. Because ultimately this inequality is caused by the political determinants of health. One last point, how can we have peace without justice first? Especially given that COVID has bared injustice and inequalities more than ever before. This is why it would be good to add, we need to call for justice, then health as a contributor to peace. Thank you very much.
Thank you very much indeed, Rita, for those stirring words, and very important as well that we get those, again, those clear values underpinning our quest for universal health coverage. Universal health coverage is a part of a wider set of political goals, and should not be, I think is the lesson that we are learning, should not be pursued simply as an end in itself. We have to think about the whole of society and the implications for the whole of society. Now, it's 12:55, we're already 5 minutes late for panel 2, so I'm afraid I'm going to move straight away into the second session of this discussion, and that is concerning the pandemic response and specifically peace building. Can the gains that we have seen, and we've already heard some of those gains, can they be sustained? And we're going to hear from several speakers who are really on the front lines of these issues, describing their experiences and, let's hope, their hopes too. So let me go first to our first speaker in this second session, Dr. Sinead Walsh, who is the European Union Ambassador to South Sudan and has served in the past as Ambassador of Ireland to Sierra Leone and Liberia. So please let me hand over straight away to you, Dr. Walsh.
Thank you very much, Richard, and a pleasure to see some familiar faces. At the moment, my work is very much on peace and on COVID, so quite a topical seminar. But just the reference to Sierra Leone and Liberia is really in reference to 2.5 years working on Ebola. So I will try to bring together some of the lessons from that, as well as we try to reflect on what to do in South Sudan. I won't go too much into the background of South Sudan. Let's just see the conflict dynamics are maybe similar to what was described about Libya. In other words, very serious, and we've actually seen a disimprovement during COVID. And on the poverty front, I think you could say maybe let's just call it the Yemen of sub-Saharan Africa in relation to the earlier speaker. It is there was a comment in the chat about hunger. So just to contextualize that, we before COVID we were expecting to have 6.5 million people, which is more than half of the population, in IPC 3, 4, and 5. So everywhere from crisis to catastrophe levels of food insecurity this year. So this is obviously getting a lot worse. So just because of time, I don't want to go too much into the background. We are in a very fragile peace process. We have a lot of violence at the moment, despite the peace process. And COVID is raging, I'm afraid. Some days we have more than half of the cases coming through as positive. But there are some I think, opportunities that we can look at. Maybe one piece of good news, because we don't get that much good news in South Sudan. There was a recent, actually, by the Liverpool School and the Ministry of Health here, which basically showed that in the first 5 years after independence, which included a couple of years of war, 2013, 14, 15, investments in health system strengthening actually did improve the vast majority of indicators of health service delivery, treatment, and so on. So I think it's encouraging for those of us like the EU investing in the health system strengthening, that even during the civil war we had recently with those. So just three ideas on maybe opportunities on how we could try to see some benefits to the peace process by how we respond to COVID. Reflecting on what we experienced during Ebola, particularly in Sierra Leone. Ebola started in an opposition stronghold, and there was a huge amount of distrust. However, eventually, after a kind of a shaky start, the government did manage, I think, with a lot of international support, to construct a pretty strong national response, which I think laid some foundations for some of those dynamics in Sierra Leone, and the sort of the move towards a national identity, I think, laid some foundations in that direction. And I think this is what we should try to also look at in Sierra Leone and in South Sudan now, the notion that there is a common enemy to all of all South Sudanese in both the government-held areas and opposition-held areas, that COVID is something that is really the enemy that we should focus on. And I think at this very fragile early stage of the peace process and the sort of unity government that we have, if we could see an even-handed response by the government, I think it could really come across to people as a peace dividend. I just wanted to mention the role of women peace builders there, because we actually have quite a strong group of women peace builders in this country who are across party lines. And I think they help to sort of put common values above the different affiliations. And so I think they would be really important in this notion of having a national project against COVID. Second idea builds a little bit on what we have done in Ebola preparedness in South Sudan over the last couple of years, given that it was on the border here with Congo. And that's trying to work but to sort of try to use health, you know, in this case, COVID preparedness as a way to bring them into the health system. And I suppose it's this notion that the health community can be seen as neutral, can be seen as providing factual information, and the notion that, again, the infectious disease is a leveler, as has been said, that won't discriminate besides the conflict. So we would hope in some of the work actually that we're trying to support in those parts of the country, in the Equatorias, that there could be a way to build some trust and confidence by how we go about this. Final point, trauma. I think it was referred to by the first speaker. It's difficult to imagine that there are South Sudanese people in this country who are not traumatized by decades of conflict, not to mention sort of peacetime issues like sexual violence and so on. So one of the things we're trying to do at the moment in the EU is support trauma healing, trauma counseling. We want to bring it to the national level. We want to bring it to the national military leaders, for example, and we really think that better mental health could have a significant impact on the prospects for peace in South Sudan. So I'll leave it there. Thank you very much.
That's wonderful. Thanks very much indeed, Sinead. And just to say, I really appreciate your very practical recommendations and drawing on your experience from Ebola as well. Thank you very much indeed. I'm going to turn now to another long-standing friend and colleague who I greatly admire, has made such a huge lifelong contribution to this field, and that's Professor Jennifer Leaning. And many of you will know Professor Leaning. She's a professor of the practice of health and human rights at the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health in the United States. Jennifer, over to you. It's a great pleasure to have you with us.
Thank you very, very much. Richard, this is a wonderful set of panels, and I am honored to be among so many dedicated and deeply experienced colleagues and leaders. My contribution, I think, is as a person sitting in the United States, which is in terms of its response to COVID-19, could be seen as a failing state, and yet I would like to, from that opening point, find a few glimmers of light that lead towards a nuanced possibility for health as a bridge to peace. I am a bit of a skeptic of this concept, not because I don't deeply hope it exists, but I have not seen it actualized in many situations of high complexity at a grand scale, which is what COVID-19 has forced upon us. But I would say that even within the United States, and especially within the United States, but I think every country in the world could acknowledge this, that this pandemic has revealed very deep fissures in our society. Really, it's as if there's a chasm that opens in terms of who gets sick, who gets help, who dies. And we have been forced as I wouldn't say a community, but as a population within the United States to talk about some very severe and ugly aspects of our particular history. And I believe that is actually an opportunity that helps towards peace building. It's essential to understand what you as a society have failed to do for the most vulnerable, or what you have, the people you have made most vulnerable by active policy. I would say the second point is that it is highlighted, not just in the United States, but around the world, those governments and those health systems that still have good tethers to the population, who will think through a strategy, actualize it for the people, and the people in general respond. Not forever. I mean, the various responses to the pandemic are really damaging to the poor, as we've already mentioned, and that's attention. But it is it has inspired a global understanding of what's happening in India or what's going on in Brazil or what Norway is doing. And there's less understanding about Africa, I would say, outside those people who study Africa very much, but a high concern about the unknowns, which I think was reflected in what the panelists today were saying. And so I would say that the unmitigated positive coming out here in terms of health as a bridge to peace is that I am astonished by the scientific community and their collaboration across countries, across industries, across universities. Now I know there's backfighting and competition, et cetera, but it has really changed in many, many ways in terms of the volume of understanding and the technological advances that we require, so that we do have an amazing international scientific community. And I think, Richard, you and the Lancet have been extraordinarily strong support of this over the past years, and you should feel that this is happening now. So this, I think, is something we should all acknowledge and take home, because there's not many victories yet. The other point I would say, though, is that it's putting an understanding, it's a global conversation about how important healthcare is. Healthcare systems, healthcare workers, all of those who help support a healthcare system, from the ambulance drivers to the cleaners to the people who provide food. And many of these people, that is, the ones who are cleaners and who basically carry people and who bring people to food, these are among the least recognized in any society. And yet these are the ones at highest risk now because of their contact with the illness. And I am extremely gratified that in many parts of the world, we are seeing who we live with, whom we often may not actually know. So there's a solidarity that is coming through sorrow. This is a very sorrowful time, but there is also, I think, a possibility to pick up some of the drivers of strength in a health system and acknowledge the tenets of leadership that are so crucial on this grand scale, and begin to actualize these values and these strengths as we look towards the next phase of the pandemic. And I also think as we look towards issues of mitigating conflict around the world.
Thank you very much indeed, Jennifer. You do draw attention to the particular circumstance of the United States in your opening remarks, and it has been I'm trying to choose the right word, devastating to see the impact on lives of the COVID-19 pandemic in the US. And I think, unfortunately, it shows the importance of the health system as an absolute frontline defense for human security. And maybe that's also one issue that's going to come out of our understanding of the impact of this epidemic, a reformulation of our notion of security. And health security is fundamental to that, but a broader, as you absolutely rightly emphasize, key workers. It is not only health security, it is human security across a wide range of social protections in our society. So thank you very much. Thank you very much indeed for your remarks. Let me move straight on to Ms. Barry Freeman, who's the Deputy Head of the UN Peacebuilding Support Office, who's going to talk also about some potential gains for peace building. So let me turn to Barry.
Good morning and good afternoon to everyone. And I'd just like to thank the organizers, WHO and Lancet-SIGHT, for organizing this. And it's very much an honor to be here with these distinguished panelists and participants. The UN Charter highlights the critical relationship between peace and security, development, human rights, and international cooperation, reaffirmed by the 2030 Agenda for Sustainable Development. The WHO Constitution declares that the health of all peoples is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. These interlinkages have been brought into acute focus during these past months. Speaking to the Security Council yesterday, the Secretary General expressed deep concern that COVID-19 makes the protection of civilians during armed conflict more challenging than ever, warning that the pandemic is amplifying and exploiting the fragilities of our world. In these past few months, COVID-19 has increased risks of violent conflict. It has exacerbated existing grievances and inequalities. Other speakers have spoken about this. These were the main themes of the unprecedented number of protests that rocked the world in 2019, and under different forms due to the virus, protests are emerging in many countries. COVID-19 is further eroding trust in government and institutions in a number of conflict-affected countries where the response has not been commensurate with the crisis and where there is discrimination in access to health services and the selective apportionment of socioeconomic support, and where government responses are impinging on human rights. Hate speech, blaming the other, and fear-mongering against vulnerable populations has also proliferated. Women are bearing the brunt of the pandemic in many countries. We are seeing increased cases of domestic violence and an overall disproportionate impact on women and female-headed households, on their economic well-being and health, and on those, predominantly women, engaged in unpaid care work. In such contexts, responses to the pandemic must be conflict sensitive and based on analysis that fully considers the root causes of conflict and conflict drivers, to avoid the risk of further exacerbating inequalities and grievances or creating opportunities for corruption and exclusion. In many countries around the world, UN resident coordinators are leading such processes in partnership with national governments with the long-term view of building back better and leaving no one behind. The pandemic offers an opportunity to rebuild trust and social cohesion, the antidote to the deep anxiety Minister Nordstrom spoke about, bringing communities and different groups together in the analysis, planning, implementation, and monitoring of programs to prevent and mitigate the spread of COVID-19 can restore bonds among groups. Recovery from the crisis can lead to more equal, inclusive, and sustainable economies and societies, and better healthcare systems are a key building block in this approach. We talked a little bit, others have talked about the Secretary General's call for the global ceasefire. 115 member states have endorsed his appeal, as have regional organizations, civil society, religious leaders, and 24 armed groups. But the rhetoric of support has not yet translated into peace on the ground, Yemen and Libya, South Sudan, and elsewhere around the world. We need to recognize in this context the importance of women's leadership and participation in conflict prevention, resolution, and peace building, the need for them to be at all levels of decision making. And this is not a new imperative, of course, but it's even more critical now, and the gender dimensions of the COVID-19 pandemic must be fully taken into account and addressed. In many countries around the world, women activists and peace builders are mobilizing and leading COVID-19 awareness raising campaigns and response efforts. They are at the front lines of the health response in many countries. So, successful efforts to thwart the impact depend on their active engagement in all contexts. Predating the pandemic, we are currently engaged in the 2020 review of the UN peacebuilding architecture mandated by the General Assembly and the Security Council. The review is looking at the extent to which the UN system is working better to build and sustain peace at all stages of conflict, and it's all in all its dimensions. So one of the unique components of this review has been the inclusive and consultative nature that we've brought in a lot of different partners in the UN system to weigh in on this. And in that respect, we greatly appreciated the very timely contribution from WHO, the white paper on health and peace with guiding principles for implementing peace-responsive health interventions in ways that address conflict drivers and improve social coherence. In the face of the pandemic, we laud WHO for leading and putting this approach into practice. And then just finally, I'd like to highlight 3 mechanisms that the UN has available to support peace building in the context of COVID-19. First, partnership with international financial institutions, which are especially critical in conflict-affected contexts. Strategic collaboration is even more important in the context of COVID-19, and the crisis has presented new opportunities to advance this partnership in different field settings. The World Bank is already financing health infrastructure development in a number of countries, with the recognition that these efforts must be conflict sensitive and attuned to the specific conflict dynamics of each country. Building on the experience of a decade of recovery and peace building assessments and post-disaster needs assessments, the UN, the World Bank, and the European Union are working together in different country contexts to ensure that pandemic recovery planning adequately captures conflict risks and supports nationally led prioritization and needs costing for building and sustaining peace, as well as economic recovery. Second, the Secretary General's Peace Building Fund, which prioritizes prevention and drives coherence across the system, is ideally placed to support conflict-sensitive COVID-19 interventions in a number of key areas. As an example, Dr. Malik spoke of the PBF project in Somalia, which focuses on mental health care and psychosocial support services to young people, supporting them as positive agents of change. While not designed to address the COVID-19 impact, projects such as this will be needed more than ever in fragile states, where we know that anxiety and uncertainty will strain mental well-being and exacerbate conflict dynamics. To respond to COVID-19, the fund offers support to help leverage opportunities for peace building and building back better. Examples include support for local peace initiatives and community engagement in implementing ceasefires launched in the context of the Secretary General's global ceasefire call. We're not there yet, but we're ready. Support for government-led and civil society-driven efforts to facilitate inclusive dialogues on health and socioeconomic responses to COVID-19 that foster trust, using discussions of health interventions and initiatives as a neutral starting point to bring rival parties together to confront the common enemy the virus presents. Support for strategic communication efforts to prevent the spread of misinformation and hate speech, and increased support for women and youth engagement in meeting the challenges of the pandemic and planning for the post-pandemic world, including through cross-border initiatives in conflict areas, recognizing that the virus knows no borders. And finally, the Peace Building Commission, an intergovernmental body with a mandate to advise the Security Council and serve as a bridge across other intergovernmental mechanisms, was really one of the first bodies in New York to be able to meet soon after we all went into lockdown in New York. Began meeting virtually in April and has really tried to focus on the socioeconomic impact of COVID-19 in fragile settings, bringing different actors together, government representatives, UN actors, the IMF, the World Bank, and civil society. And it's a solidarity platform. It serves an advocacy and resource mobilization role, and is really working to help drive the coherence needed across the UN system and across the humanitarian development peace nexus, breaking the silos, if you will, and bringing actors together around this common challenge. The COVID-19 pandemic presents a host of new challenges. We've spoken about them today, but there are also opportunities. So I think the question to all of us is, can we come together in solidarity to meet the challenges while also seizing the opportunities? I think it's probably too early to talk about sustainable gains, but I think we can all recognize that we do have the tools to identify the opportunities, to nurture and sustain them if we work together and in partnership with the governments and the people we serve. We need to collect data and evidence, and we need to analyze and evaluate approaches on mobilizing health as a bridge to peace in real time if we are to strengthen and make them sustainable, recognizing that such approaches will be context specific and that no one size fits all. So I think I will stop there. I do believe that we at this point, we can only build back better together. So thank you very much.
Richard, you are muted.
Sorry. I was on mute. Thank you, Barry. I just wanted to emphasize how pleased I was that you drew attention to the fact that women are often bearing the brunt of this pandemic, but at the same time are providing key leadership roles. And the SIGHT Lancet Commission, of course, does include SDG 5 as an absolutely crucial dimension of its work on health and peace. and justice, and this is a great spur to that work. Let us turn to our final speaker in this session, and it's a great pleasure to see you once again on the screen, Minister of Health in Amman, and that's my friend Dr. Ahmed Al-Saidi. Dr. Ahmed, over to you, please. It's great to have you with us. Thank you for being patient.
Good afternoon from Muscat, Your Excellency, our RD, Dr. Ahmed Al-Mandari, colleagues, and Richard. It's so great to see you. I'm delighted I could see you on the screen, and I wish I could see you live somewhere soon, either in Muscat or London or wherever. I'm honored and delighted to be given this opportunity to share some of my thoughts with my colleagues regarding this devastating pandemic which impacts the whole universe. And despite being the final speaker for today, I would like to express my deepest sympathy for all those who are very sadly affected by COVID-19, and also to express my gratitude and thanks to all healthcare workers worldwide and their colleagues from other sectors who've been doing heroic jobs, and some of them under very, very difficult circumstances. This pandemic can bring out the best or the worst in us. It can provide us with a golden opportunity to work together, to learn from each other, and to help each other. Or unfortunately, it could deepen our divide and differences. COVID-19 had devastating impacts, economic, health, and social, on countries with excellent healthcare systems and almost unlimited resources. I would leave it up to you to imagine what impact it will have on countries in our region who have already fragile healthcare systems, very poor resources, and unfortunately their healthcare system is weakened further by prolonged conflicts and also limited movement. It is very clear to all of us in this region, which unfortunately the worst worldwide affected by conflicts, and sometimes it's war by proxy, unfortunately. And so many partners playing role in these wars without having even to stop to think about impact on these countries, whether it's from economic, social, or healthcare system. Our neighboring country, Yemen, for example, they had devastating system. More than 60% of their healthcare facilities were not functional before this pandemic. It's also very clear that with most of these conflicts, there is the way out is there. If there is a political will for people just to sit together and talk to each other, I'm sure there will be a way out. But unfortunately, as I said, there are so many hands which are playing in these wars, and some of them from far away places, but they have a very strong, unfortunately, impact and influence. Before pandemic, Corona pandemic, COVID-19, with my brother and friend, Dr. Ahmed Al-Mandari, who was a staff at the Ministry of Health in charge of our quality department, we came up with the initiative, Global Health for Peace Initiative. And I'm grateful to the government of Switzerland for being the first co-sponsor and partner, and then many other countries joined. We were meant to have a major side event during May this year, this month, with the assembly, and I was hoping Richard would have been the moderator as well, but unfortunately COVID-19 prevented us from that. But I can assure all my colleagues that the idea is still there. We are working with Switzerland and other countries, and hopefully next year, if not before, we will have either as a side event or a separate meeting for Global Health for Peace Initiative. It's very close to my heart, and we will never abandon it. Let me turn now to Oman's position in this region. Our late Sultan Qaboos did everything he could to moderate and bring peace to the region. But it takes more than one country or one leader to do that in a region which is unfortunately for decades now, I'd not say centuries, having so many conflicts, and what is termed as the Arab Spring for many of us unfortunately turned to be very hot summer in the region. And instead of bringing peace, prosperity, and improving healthcare and education in these countries, it set them back for decades as well. I'm glad to say His Majesty's Sultan Haytham, who is the successor of late Sultan Qaboos, promised to do the same and continue in the same position that Oman always took, of being moderator and not siding in any conflict. And he had the support of all of us in the government and in the country. I urge all of us, all concerned people and countries, to seize this opportunity of this horrible pandemic, to find a way to use this pandemic and health in general as a bridge to peace. It's doable, it's possible. And I know that my colleague, Dr. Ahmed, tried, and he will keep trying to do that as, for example, in Yemen. And I can also speak on behalf of my government that will be more than happy and willing to host any meeting that will help to relieve and ease the misery that many of our neighbors are suffering, and not because of the diseases, only diseases that unfortunately made worse by starvation, by, as I said, ruining of healthcare facilities. It is very difficult even sometimes for us to have permission to ship help to neighboring countries, medical supplies. It is, I'm amazed, and I'm actually not amazed, I'm horrified. Why don't these people just sit and look at some of the images which come out of either Syria, Yemen, Iraq, Libya, you name it. 65%, I don't remember, 65% of people who are displaced are from our region, Eastern Mediterranean region. 70% plus of those who need help are from this region. And honestly, I don't see any reason for that. Apart from, may I say, Richard, stupidity? May I say just sometimes? May I say, unfortunately, misunderstanding? Not willing to sit and listen to the other side? So I hope that all of us will reflect and look at the effect of this pandemic and again work together. And as the WHO director always say, solidarity, we need that worldwide now. We don't need to highlight our differences. We don't need to highlight our differences now. We need to unite all nations. Scientists, as the speaker, I think from Harvard said, they are doing an excellent job. But unfortunately, they need the politician also. And I'm not one of them. I'm healthcare provider, but they need to sit together also and do a good job. Sorry if I took more than the 7 minutes, but it's always a delight to see Richard and the team there. Thank you very much.
That's wonderful. Thank you so much for those very thoughtful remarks, and it's great to have you part of this. Well, look, it's 28 minutes past. Unfortunately, we don't really have time for a deep question and answer, but I do just want to close by making a few comments. First of all, pandemics do change societies. Our societies will be changed by this pandemic. Our governments will be changed by this pandemic, and our publics will be changed by this pandemic. Our peoples who we are part of and who some of us represent will have high expectations and demands of their governments. There will be a rebirth of the state after this pandemic. We are seeing it now. The only way to protect societies, protect economies, lives and livelihoods is for the state to be strong, to be efficient and to be effective. And we're seeing in all countries the state play a crucial role in protecting the lives and livelihoods of their people. So this is an opportunity to rethink the relationship between the state and society. And we need to have a voice in that as a health community, as a set of institutions representing the health community. And a second point I would like to make, and this is very important because I unfortunately have been in this world of global health for too many years. After Ebola in West Africa, I remember attending many meetings, including those at WHO in Geneva, where promises were made from donors, from multilaterals, from non-governmental actors. And those promises were well meant and well intended, but they were never delivered on. And the commitment to reconstruction in West Africa never took place at the level that it was initially promised. There will be many promises and many commitments made during this pandemic, and it's essential that we as a health community hold those with power accountable for their promises and the commitments that they make, to make sure that we do indeed address those communities who have been most affected, and they are the communities who sit in the most vulnerable parts of the social gradient in our societies. So I would like to thank our co-host, Dr. Almandari, and all of the wonderful team at EMRO. Thank you so much. And I'd like to thank my friends and colleagues on the Commission, President Halonen and Peter Freeberg, and particularly to all of you. I think we got up to 83 participants at one point for taking the time to join us today. You've been magnificent. And a big thank you to all of our speakers who've been so passionate, thoughtful, and insightful. So even though we can't hug each other, we can at least clap each other. So thank you very much to everybody for your excellent work. I really appreciate it. And stay safe and be strong, and solidarity to all of you.
Thank you.
Thank you.
Thank you, Richard. Thank you, colleagues. Bye-bye.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you so much, everyone.